Hello and welcome to the Homeless Consultant channel. My name is Paul B. I am the Homeless Consultant. Today I am going to go back to the topic of junk science. I need to finish this up and get on with the other 44 existential threats to the United States of America that I have not spoken about yet, but I have become entirely bogged down in the quicksand of junk science. I think I've done 8 installments on it. What I'm going to do today is give you 2 current case studies in junk science. If you haven't watched my series up till now, I highly recommend that you watch it before you listen to this video. What I say here will make some sense to you without it, but I really want you to understand a couple of things. First, I want you to understand the things I told you in those videos that explain in depth and detail how junk scientists work and how their focus has really nothing to do with science. It has everything to do with influencing other people, particularly controlling other people. And that ain't science, folks. The other reason I want you to go back to the other videos is because these are 2 current examples in the news today. Open up your newspaper, turn on your internet, your whatever news service, you're going to see them in the news right now, and they've been in the news recently. I talked about all this in my videos before these 2 showed up in the news. And I want to make that point clear, because what I did on the junk science series was not responding to things like this. These people are fulfilling exactly what I told you about to a T. They're doing exactly what I told you junk scientists do. And I want to make that point clear because it only validates everything I've been saying in the rest of the series. So I'm just going to jump right into it now in the interest of time. The first one I want to talk about is, let's see here, is coronavirus. Sorry, I had a little bit of a cough there. I hope I don't have the coronavirus. I hope I don't have coronavirus. I mean, I usually don't cough like that. I don't. Where's my phone? I gotta call a doctor. I gotta call a doctor. I'm coughing. Oh my God. I've got coronavirus. I've got coronavirus. If you're not familiar with what coronavirus is, then I legally declare you dead. Because one of the features of fear porn is that it's everywhere. Because if it isn't everywhere, you might not be terrified. And that's the whole point of fear porn, is to terrify you. Because when you're terrified, you are vulnerable. You feel out of control, and you look to somebody else who is going to take control and take care of you. At least when you're raised in a society like the one that we've created over the last 30 years, where everyone's dependent on government instead of being competent for themselves. Coronavirus is, you could say it's kind of like the flu, but it's actually more of a, like SARS. And if you look back through my videos where I talk about previous health scares, you got things like red dye, Ebola, and SARS. Okay, I don't remember exactly with SARS. I think 700 people died from it, which is about 3 years worth of Minnesota's homeless people dying. There was a huge international response to SARS. There hasn't been a single response to the homeless in Minnesota. And that's just Minnesota, a state with a very small population. Why was all the news and everything and all the money and politics and everything devoted to SARS when it kills far fewer people than the number of homeless people who die unnecessarily in Minnesota? Twice the mortality rate of the general population. That's how many homeless people die here. Quote, hundreds each year, according to social services. Coronavirus is the latest one. Came out of China, came out of Wuhan, China. There's no doubt that this one is worse than SARS. More people are getting it, more people are dying from it. However, as of this time, which is maybe a month or 5 weeks, 6 weeks after they started talking about it, less than 4,000 people have been, quote, confirmed dying from it. And when you're dealing with junk science, you don't know what the truth is anyway. But on the one hand, you have the Chinese who are going to under-report what's going on because they're a communist country. They're supposed to be in control of everything. That's like I was just saying. When you go to a communist or a socialist nation, the government's supposed to take care of you. And since they're completely incapable of it, because government is just a bunch of random yahoos, since they're utterly failures at that, when something like this happens, they underreport things. They actually are over there imprisoning, persecuting people who are trying to tell the truth about how many people are getting sick with this thing. That's communism for you. That's your national health care system for you. Can't wait for that to be here, right? Vote for Bernie. Well, on the other hand, on the other side of the water there, you've got the people over here who live in what used to be a free country. It's teeter-tottering between, well, we're not free at all, but where we could conceivably get our freedom back and where we're going to go to where China is right now. So at this stage in America, the junk scientists, it benefits them to over-report things. So while the Chinese want to under-report, they might have, who knows, 100,000 people dead from this. I'm not saying that's happening. I'm saying that it could be. You don't know because they don't report. They don't tell the truth. They're a communist government, for heaven's sakes. They're a communist government. They don't tell the truth about anything. They don't want people to know how many people are suffering and dying from this because it makes them look like they're incompetent. Well, I'm sorry, it reveals the fact that they are incompetent. Over here, they want to, give the highest estimate of people dying from this they possibly can, because the more of that, the more people you can say are dying from it, the more terror is generated from this fear porn, the more they take control over us, so that they can become like communist China, who is a complete and utter failure. Perhaps you see how all this ties together. You see, that's the problem with people who are not educated very well. And our rotten education system is one of my existential threats to the United States of America. You can watch that video as well. So when it comes to this, let me see what's next on here. I want to emphasize again that when I started my series on junk science, this was not even mentioned. You hadn't heard of this, coronavirus. That is how fast, when the opportunity arises, that is how fast these junk scientists, I don't have a book handy, but they grab the playbook that anti-smokers created for creating a mass panic, terror, fear porn, to take control over public policy. They open it up to page 1 and they start checking off the boxes. That's how quickly this has happened. Now the thing is coronavirus really some huge pandemic that's going to kill us all? Well, no. I'll just give it away. Why spend too much time talking about it? It seems to be killing about as many people as the flu does. And you know what? The flu is a big killer. It always has been. The flu can kill a lot of people, or not as many, year by year. As recently as, I think it was 1918, at the end of World War I, the Spanish flu there, that killed a lot of people. That was compared to the Black Plague of the Middle Ages. The Black Plague was generally regarded to have killed about 1/5 of the human population on the entire planet. Now, the Spanish flu did not kill that percentage of people, but it killed roughly that number of people, which is estimated. They don't know. This is my point. They don't know. They're scientists who are supposed to be dealing with precision, and yet the estimates run from 50 million who died from Spanish flu to 100 million. That's a pretty big margin of error. 50 million to 100 million people. Probably most of the countries on Earth don't even have that many people in it. That's their margin of error from these experts. After 100 years to try to figure out what happened. They have no idea. But the point is, it killed a whole lot of people. So let's go the low end, 50 million people. Tell you what, I'll give you better odds. I'll cut it in half. 25 million people who died in the Spanish flu. How many do we have from coronavirus? How many millions? Oh, it's less than 4,000? 4,000? 4,000? What do you know? That's about how many people the flu kills. I mean, there isn't all this big hullabaloo and stuff in the news about the flu all the time, right? What's going on here? 4,000, you think about it, the world probably has about 10 billion people in it right now. I know they always say 7 billion, but you know how it is. It's about 10 billion people on this planet right now. I did a little math before this. If you take the 4,000 people who've died in the last year from coronavirus, and you maintain that going forward, it would take 2.5 million years to kill off all the people who are living on Earth today. And that's assuming that we don't give birth to another person, and that these people live to be 2.5 million years old, at least until coronavirus kills them. Okay, one of the problems with our rotten education system is people are innumerate. They're not just illiterate, they're innumerate. They can't comprehend numbers and scales of numbers. When you get into billions of dollars and trillions of dollars, people just don't comprehend the magnitude of what you're talking about. By the same token, when you talk about 4,000 people dying out of 10 billion, people do not understand the lack of magnitude. Give it a few months, you'll have 4,000 people dead in car accidents in the United States, maybe just from alcohol-related car accidents. More homeless people die unnecessarily in America probably in 1 or 2 months than 4,000. Where have you heard them talking about the homeless? These people claim to care about people, right? They're all about health. They're going crazy, mobilizing, which means taking money and spending it or pocketing it. They're mobilizing to deal with this because they care about other people, right? They don't want other people to get hurt. They don't want them to die. Except for those, 4,000 or so homeless people nationally every couple months who die because they're homeless and nobody's doing anything to help them whatsoever, including every single one of these junk scientists who claim to care about people. Perhaps you understand what's going on there. You see how all this ties together. So what do we have with coronavirus? We have constant news coverage. You can go into the news service I jump to. I don't know why I go there. It's not, they all blow. They're all terrible. They're all junk, fake news. But I go to one in particular just, I think, because their webpage loads faster. I mean, it's all a pack of lies. But lately when I'm in there, coronavirus, all over the page. For what? For something that's killing the same number of people as just ordinary everyday things that kill people. Car accidents, I mean, what really got my gander going here was at work, the Human Resource Department started posting up a bunch of signs, started sending out emails. You see, when you run a department that really isn't valuable for most of what you do, you look for a reason to justify your existence. So when something like this happens, they love it, and they start sending out all these emails and educational programs, and they just kick into high gear to try to justify their existence. Human resources. If you look at my existential threats to the United States of America, one of them is corporate inhumanity, which is almost synonymous with human resources. We'll leave that for the video on that topic. But our human resources started sending out these memos telling us grown adults what to look for with this coronavirus. Now, they never bothered to mention, oh, by the way, coronavirus really isn't fundamentally different than the flu in terms of how it's transmitted, in terms of, how it makes you feel rotten. It makes you feel rotten in a different way. Affects your respiratory system. It kills about roughly as many people as the flu kills. They never mention that. They're joining into the fear porn. But they threw something in there I found fascinating. Among other things, they said, stay home if you have even a minor cough. Excuse me. Oh, shoot, where's my phone? I've got coronavirus. I have a minor cough. Oh my god. Oh my god. Oh my god. I gotta call an ambulance. Stay home from work if you have even a minor cough. And they wonder why they're talking about this affecting the economy. The implication of the way that this was worded at work was that if you have something that we deem maybe even more than a minor cough, we're going to make you stay at home. We're going to make you stay at home so that you can't, earn money to feed your family, for example, pay your bills. Or you'll have to go to one of those government programs, workers' comp or something like that. They're going to force it. For what? For something that's the same as the flu. It's nothing. This is fear porn. This is junk science. Junk scientists jump on these kinds of things all the time. Every chance they get, they will jump on it. They open the playbook to page 1 and they kick it into gear. Start checking off the boxes. Same thing happened with Ebola, SARS, all of them. And the fact that this one has more people dying than those isn't relevant, because it's 4,000 people out of 10 billion people. It's a tiny itty bitty number. Most people who get this survive it just fine, just like the flu. The people who seem to be most susceptible to it are people who are susceptible to disease. The elderly, invalids, people who already have existing conditions that make them susceptible to a relatively simple illness killing you. There's nothing different here, folks. There's nothing. But as soon as it started hitting the news, though, you could almost hear over at the CDC, the Centers for Disease Control, and the National Institutes of Health, you could almost hear them waking up from their government jobs, waking up and going, what? 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 We're relevant again? We're relevant again? Quick, get the playbook. Go. Go. Get the playbook. Number 1, fear porn. We gotta get the fear going. Contact the media. We'll get the press release started. Come on, go. Hit it. Time to make money. It's money time. While they were sleeping on the job there, not doing anything, they were not helping the 4,000 homeless people who die unnecessarily every couple months across America. They were not doing anything whatsoever for those human beings, and yet they claim to care about human lives. These people are liars. They're sick. And the whole basis of this is junk science. When it comes to homeless people, there's no fear porn. There's no abundant media coverage. There's no abundant action. The government isn't kicking into gear. People aren't criticizing government officials for their failure to act. There's nothing. There's just homeless people suffering and dying off camera, and that's it. In far greater numbers than coronavirus is killing people. This one gets me angry. So what do? They open up the playbook, and what are they going to do? You're going to saturate the media with fear porn. In other words, you're going to manufacture fear and terror where it did not previously exist. Why didn't it previously exist? Because there was nothing to be afraid of. There was nothing to be terrified of. Just like anti-smoking. 500 years, people smoking, not smoking, working together, playing together, getting married, raising kids. Everything's fine. There was nothing to be afraid of, so there was no fear. There was no terror. But as soon as the anti-smokers took over and started spreading, saturating the media with fear porn about tobacco, all of a sudden, everyone's now terrified of smokers, terrified of tobacco. Spending taxpayers' money, that's the next thing you want to do. Start spending it. You need to project this image to the media that you need us, you need the CDC. You need us. See, we told you so. You thought we were asleep on the job, but you need us. We're the ones who can save you from this possible, maybe, we're not sure, maybe pandemic. And all pandemic is, by the way, is an epidemic that's spread around the world. An epidemic doesn't necessarily mean a problem, as you're going to see in part 2 of this today. The next thing is, in other words, again, they're pushing themselves. It's self-aggrandizing. It's self-absorbed. We're the CDC. We're the National Institutes of Health. We're the World Health Organization. Listen to us. Do what we say. Give us power. Give us control. In all I just mentioned there, what was actually other people had to do with that? Nothing. They're just suffering and dying. They've got the flu. They've got coronavirus. They either come out of it fine or they die, just like with the flu, just like with everything else. It's all about them. Quick, while the fear is heightened, while we've got everybody terrified, you got a brief window where you can pass some really oppressive laws, particularly laws that tax people and steal their money and give it to us. Quick, now's the time to do it, because we can't maintain this coronavirus farce as long as the anti-smokers haven't maintained the anti-smoking farce, where they can keep raising taxes over and over and over for decades. So we got this brief window of time. Now's the time. We got to take emergency action and pass laws fast. That's how they influence public policy. And that's why they keep this fear going as long as they can. They need that window of time to without being elected to office, to take over public policy. And then lastly, you have to use it, of course, as a weapon against your political enemies. When Donald Trump, I am so grateful that Donald Trump is the president when you have something like this, even though this one really doesn't scare me in the slightest at all, one itty-bitty tiny bit. I have always maintained a healthy respect for the flu, and I do everything I can to prevent it. And hey, what do you know? I haven't had the flu in 25, well, it's about 30 years now. I keep saying 25 years. Since I stopped using our healthcare system. I haven't been sick since then. What do you know? What do you know? But these people come out, and Donald Trump, one of the first things he did was he stopped travel in and out of the country in order to make sure that this virus does not get into the country. A great thing to do, something that his predecessors would not have done. And they complained about him. Oh, it's too soon. How could you stop travel? You're going to kill the economy. The economy that they don't, whatever. Why even bother? These lunatics on the left. So anyway, they're criticizing Trump because they hate Trump. Well, then what? Later, then they turn around 180 degrees later, and then they say, well, you did it too late. See, we've got a death over in Washington from coronavirus. If only you had had this travel ban earlier, Trump, that person wouldn't have died. We could have saved that one person if it wasn't for you, Trump. That's what these... So you take the fear that you've generated and you use it against your political enemies, which means you don't care about the truth. You don't care about science. Your only concern is you, me, myself, and I. What can I personally get out of this? Every person who dies from coronavirus going forward, sweet. I can use it against Donald Trump. Bring the body bags. Same thing they did with smoking. Someone died of cancer? Sweet. We can get better funding next year now. Thank goodness. Get the body bags. Let's see how many more we can find who are dying of cancer. It's only going to increase our funding, give us job security. We'll do everything we can except cure cancer, as you'll see in part 2 of these case studies. All right, now I want to emphasize that the science, the real legitimate science of biology, molecular biology, viruses, disease, the actual study of those things, it's amazing what scientists have managed to learn. It's amazing what they've done. Even the idea of a vaccine is an amazing thing. Now it's being corrupted. That's what makes vaccines so scary. That's why you got to watch out for vaccines. It's not that the concept of a vaccine itself is a bad thing. It's that, like everything else, it's being weaponized. But the fact that we can come up with something like that is an amazing scientific success story. But it gets polluted by the junk scientists. So there's people out there in the background who you never see on TV wearing a bow tie who are actually doing the work that helps us understand the reality of what these viruses are and how they function and how they hurt us. But then you get the people with the bow ties on TV who are using all this with the fear porn to benefit themselves and their agendas. See, this isn't the science of biology that's at play. When you talk about coronavirus, there are people out there studying it and researching it in the background, off camera, behind closed doors. The people who are yapping and shooting their mouths off about this and scaring the living daylights out of people deliberately, they're not appealing to legitimate science. They're appealing to epidemiology. One of the crown princes of junk science. If you don't know what that is, look at my past videos on junk science to see what epidemiology is. But it has nothing to do with real science. It's a bunch of numbers and statistics. It belongs in Las Vegas. It has no business being anywhere near science. You know, what's interesting is that, the thing that founded epidemiology was John Snow studying graphs of plotting points of where people were getting sick in London from the cholera epidemic. From that, they centered in two spaces. He found that in the middle was these water pumps. Hey, maybe the water's contaminated. Duh. Okay, something a small, itty-bitty little child could do if they thought about it and if they had enough of an education so that they knew how to think, which America does not provide small children today, or adults for that matter. But one of my existential threats to America. You see how all this ties together again and again and again and again. Then Ignaz Semmelweis, right, when he's finding out why these women were dying in childbirth when they shouldn't be, but only at one clinic. And what did he come up with? He said, well, in the end, he found all you have to do is, after you do an autopsy on a dead body, wash your hands before you go help the woman give birth. Then the woman won't die after she gives birth. Just wash your hands. The same thing the Bible told you to do after handling a dead body 4,000 years ago. What did the medical experts of that time say? They destroyed Ignaz Semmelweis for suggesting such a thing. That's ludicrous. You're making it sound like we're killing those women because we're not clean. Yeah, that's exactly what he was saying. You know why I haven't gotten sick in the last 30 years or so? Partly because, well, mainly, I give credit to God. But as far as what I'm doing on this earth, I stopped using our healthcare system because it kills people. And I just started maintaining my hygiene, which is nearly impossible when you live in a car, by the way. If you wonder why the homeless are susceptible to this, why the homeless can become a source of a big outbreak that can infect the general population, it's because these people I'm talking about don't do anything to help the homeless. So they have no hygiene. They took the money from anti-smoking, from tobacco taxes in Minnesota, and they used it to build a football stadium for a privately owned football team. They didn't build a single sink and faucet for the homeless. So I have to fight an epic battle every single day of my life to maintain my hygiene. And it ain't where I want it to be, folks. If anything scares me about coronavirus, it's the fact that I am not able to maintain my hygiene to the standards I want to. But beyond that, it's just another sickness, just another disease, whatever. I'm not going to be terrified of it. But this is all junk science. Now, I want to give you just an analogy of what this is like, what these people are doing, the CDC, the fearmongers. Here's exactly what is going on. Imagine you're back in the Middle Ages or ancient times. You're in a city like Jericho. You're in a city like Jericho. It has huge high walls to protect you, right? Now, it'll protect you unless some really big army with siege engines and everything comes. Let's just say, for the sake of argument, there's only one window in this wall around the city. You're the one at that window. So you look out the window and you turn around and you tell all these thousands and tens of thousands of people in your city, There's an army coming over the hill. And you look back out the window and you go, they're huge. They're huge. There's tens of thousands of them. And you look out the window again, you turn around, they've got siege engines. They've got battering rams. We're all going to die. And all of a sudden you've got thousands of people in the city going, oh my God, we're all going to die. We're all going to die. But then the person at the window says, don't worry, I'm going to take care of this for us. So he yells out the window, go away or I'll harm you. And then he says, hey, they're turning around, they're going away, they're leaving. And everyone in the city puts him up on their shoulders and parades him through town. Yay! Look who saved us from this horrible threat that we never actually saw or comprehended or had any proof whatsoever that it ever existed. You see, that's the problem with broadcast media. You can't challenge what you're being told when people broadcast to you in a one-to-many relationship, which is what broadcasting is. That's why these people seek to control the media immediately. That's why when I go to that website, coronavirus, 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 coronavirus. These people are looking out the window, they're telling you about the terrifying army that's headed your way called coronavirus. You can't see any of it. It's like, where's all this stuff happening? I don't see it happening here. And then when it's gone without killing you or your family, you're going to look to them and say, oh, thank God the CDC was there. They saved us. We all could have died. Let's get more funding for the CDC. That's how junk science works, folks. That's exactly what's going to happen. That's what happens every bloody time that they do a health scare. Every single time. So again, I'm just going to help you avoid the coronavirus the best way I know how. Of course, saying I'm not a doctor. I'm not giving out medical advice, but I will tell you what I do. I wash my friggin' hands. You see, the thing that the medical experts told you didn't have any impact on keeping you healthy back in the Middle Ages. They were the experts. They were the PhDs. They were the doctors. They even had laws passed that forced these women to go give birth at government institutions. It was illegal for you to give birth at home. Sound familiar? Those are the people who said washing your hands is pointless. It doesn't do anything. What a stupid idea. I wash my hands. I try not to touch orifices of my body where a disease could leave my hand and enter, like my eyes, my nose, my mouth, my ears. I try not to do that the most I can. And I wash my hands. Just a suggestion. See if it works for you. All I know is I haven't gotten sick in the last 30 years. Okay, so I'm going to leave it at that as far as coronavirus is concerned. Let's move on to the second contemporary example of junk science in the news, taking control of public policy.